Thank you for joining us for today's edition of Health Talk. Today's program is about some exciting technology in Pikeville Medical Center's Rehabilitation Center. It's called the Lokomat. We'll learn what the Lokomat is and how it works. We will meet the therapists who work with our patients on the Lokomat as they take us step by step through the process of Lokomat therapy. We'll learn who benefits from the Lokomat therapy and much more. Right now, let's meet the ladies who work the Lokomat.
My name's Shalonda Brown. I'm a physical therapist. I've been a therapist for 12 years. I've been here at Pikeville Medical Center for 2 years. I've been working with the Lokomat since it has arrived here at Pikeville Medical Center. Myself and 4 other therapists have been trained in using the Lokomat, and we are also now certified trainers that we can train other therapists to use the Lokomat. So we're very excited about it being here and excited to let the community know what it is and everything about it.
Hi, my name is Tracy Tipton. I've been a physical therapist here at Pikeville Medical Center for the past 14 years. I have been working with the Lokomat since its arrival here in Pikeville. I'm also been certified with Shalonda on the use of the Lokomat and to train other therapists. I'm excited here to tell you today about how we can help you and your family members' needs and how to get your walking better.
Lokomat? What's a Lokomat?
The Lokomat, how I like to explain it to patients initially, is it's a robotic device that helps you get back into your normal walking pattern. What it is you're strapped into this machine and your legs are hooked onto the robotic pieces, and it gets you back into a normal walking pattern versus a slide or a step 2 pattern or something that is not normal in the community. We want to get you back into your fluid movements, back into the way a normal person walks.
Also, it does have a harness that is attached to you that will keep you up in the air, so it's very safe, very secure. We will be there with you at all times. There's always at least 1 or 2 people with you. You're never left with a Lokomat. And again, it just helps you to walk. It teaches you your normal walking pattern. Whatever the reason that you're having difficulties walking, this machine will help you get back to a normal pattern.
What conditions can be treated with a Lokomat?
The Lokomat can be used for several different types of patients with different diagnoses. We use it a lot with spinal cord injury patients, stroke patients. We also have a pediatric portion to our Lokomat, so we have children that we can put in the Lokomat that possibly may have cerebral palsy. Any type of diagnosis or treatment that you need to assist you with walking, that's what the Lokomat can do.
Some other conditions that can go in is patients with multiple sclerosis, patients with balance issues. I had one particular patient with cerebellar ataxia. The cerebellar ataxia, for those of you that are unfamiliar with that term, it's the cerebellum is what controls the balance in your brain, and so if your balance is off, the Lokomat can get you back on your feet again in a straight pattern to walk in a straight line versus all over the place.
There are some patients that will not be able to use the Lokomat. We have several restrictions. One is if you have a significant leg length discrepancy, if one leg is much longer than the other or shorter, will not be able to use the robotic legs. It will not work. If the patient is over 300 pounds, also the Lokomat does not support that, so they will not be able to use. And if they have significant osteoporosis, would not be recommended to use the Lokomat due to the diagnosis of osteoporosis. And the reason we cannot use the Lokomat with patients with osteoporosis is it can be more detrimental to them than beneficial due to the diagnosis. It is a brittle bone disease, and it just can will not benefit the patient. It would hurt them more than it would help them.
Some of the other contraindications for use of the Lokomat is patients who have recently had any kind of surgery or have any staples or wounds anywhere on their abdomen or their legs, anybody with a broken hip or broken bones in their legs, and anybody with any open wounds could really hinder their use of the Lokomat.
How does the Lokomat work?
Well, we get a referral for the Lokomat and from the physician, and we assess the patient if they're able to tolerate being upright and standing. If the patient cannot be standing on their feet for any length of time, then they're not appropriate for the machine. We also will make sure that they've covered all of the indications for the treatment, have a good diagnosis, and they have a bad walking pattern. We will attempt to put them in the Lokomat. And the first step is to get the measurements. We measure the length of the leg, then we measure the length of the bottom part of the leg, the top part of the leg. We will measure their circumference of their thigh, their calf, and their ankle so that we can get all the right body parts onto the machine so that it would fit their body accurately.
If the patient is able to walk, we have an incline that goes up to our Lokomat, so we can assist them up to the Lokomat. If they cannot walk, we will put them in a wheelchair and push them up to the Lokomat. There are harness straps. Once we fit them with an appropriate belt to their size, we strap everything in. We will assess their size for the belt before we put them in the machine. We will put the harnesses and strap. There's 4 straps, and we will put that on there. And then we will put there's 3 leg cuffs, and we will put each of those on their thigh, their calf, and their ankle, and strap all that in and get them in nice and snug before we can begin the walking patterns with the patient.
Once you're strapped into the Lokomat system and you're raised up in the air is when you'll feel the most pressure around your abdomen, your stomach, and your groin a little bit that's where the harness is actually taking the weight off of your legs and lifting it up onto the Lokomat system. Once you're up in the air, we've got everything hooked up and we're ready to start the walking process, the first thing you will do is you walk in the air. And that just gives you an idea of what it feels like, how it's going to move you. Once you get comfortable with that, then we put you down a little bit towards the treadmill. The next phase in the Lokomat training is what we call kissing. We will lower you down to where your feet are just barely touching the treadmill. This is our time to look and see and make sure that your foot is clear on the treadmill, that your knees bending when it's supposed to be, your hips are bending when they're supposed to be. And this is the time when we take extra measure, which we do through the whole process for safety, making sure that the harness is on right, where the leg straps are on right, and that you are comfortable as you can be in this machine.
After the kissing phase is where we actually will put a little more of your body weight onto the treadmill. Again, we will be with you at all times. There will always be a therapist with you. We will not leave you. There is a safety button on the machine. If at any time that you need to get out of the machine, we can get you out of the machine quickly. We just want you to be safe. We want you to be walking normally, and we want you to be safe during the process of being with a Lokomat. There are different ways you can progress. After the kissing portion of the treadmill, we can progress the patient by lowering more of their body weight onto the treadmill while they're walking. We also can increase the speed of the treadmill, and we can increase the resistance added to the treadmill while the patient is walking. There is a monitor in front of the patient at all times that gives the patient feedback as to how much they are working or how much the machine is working. We will tell you, as the therapist beside the patient, we will tell you when to work harder or when you can relax and let the machine do it. There are safety stops on the machine. If at any time you feel uncomfortable or you feel like you need to be out of the machine, we can get you out. We also, as a therapist sitting beside you, will have what's called a telestop, which is a small button that we will push every 3 minutes to make sure that we stay with the patient. It's just a safety portion of the Lokomat that all Lokomat users will have to use. The monitor with the Lokomat has several different settings on it. The one we use most is just a smiley face. We use it with our adults and our pediatric patients. As the patient works harder, the smile gets bigger. So that's how they know if they are working, or if they start to slack off a little, it goes into a frown. So we have to encourage them and motivate them to go ahead and make that smiley face. We do have a pediatric attachments to the Lokomat. We are very blessed to have that. We are 1 in 17 facilities that has that in the country. We're the only one in the state of Kentucky that has the pediatric portion of the Lokomat. So we are very blessed and very excited to have that and offer that to our children and pediatric patients.
What about age and size? Are there restrictions?
Restrictions aren't necessarily with the age. We can put children in as young as 4. It's based on the length of the bone in your leg. So once we measure that and it fits into the legs of the Lokomat machine, we'll be more than glad to put you in it. Size, the only restriction with that is it doesn't go about over 300 pounds. Other than that, we'll try anybody.
One thing that we want you to understand is that you will be assessed by a physical therapist before getting in the Lokomat. You do need a referral from your physician, but if you have any questions at any time, you can always call here on the inpatient rehab and contact us, speak to one of the therapists, and they will explain it to you. And also you can ask your doctor and they can explain it to you. If you have any additional questions, you can contact any therapist here on the inpatient rehab at 606-218-1053, and they'd be happy to answer any of your questions. You could also contact your physician and they could get you the right process if you are assessed and appropriate for the Lokomat to get that started.
Who benefits from a Lokomat?
Some of the benefits of the Lokomat, of course, is to help you walk. That's what the Lokomat is for. It is to improve your walking. For whatever reason that you're having difficulty, it is to help you to make your walking more natural. I have a current patient that I'm treating now. It's a spinal cord injury, and he loves the Lokomat. He is coming in now for twice a week training with the Lokomat to learn to walk. He is unable to walk when he came in. He is making progress. He's doing well, and he's able to stay close to home, and that's why he loves our Lokomat, and he loves coming here for the training. It's just easier for him and his family to be close to home.
We are very lucky in this area to have the Lokomat system. We are 1 out of 70 units in the entire United States. And like Shalonda said, 1 in 17 units in the United States that can do pediatric patients. We've had people drive short time, long time, 10 minutes to an hour to come to us for the Lokomat training as an outpatient basis. We also have patients that are inpatient on our rehab unit that we have been putting in the Lokomat 2 and 3 times a week. I've had several patients in there that are stroke patients, stroke survivors that have learned how to walk. Even just for several patients were just in the air, doing the air walking. The next time we walked them on the ground, they had more movement in their hip. The next time we put them in the Lokomat, they were able to get down and do the kissing phase. Then we put them back on the floor again, and there they are moving their whole leg, and we don't even have to help them. I had one particular patient drive from Sayersville to us. He had cerebellar ataxia, which I had talked about a little bit earlier. His balance system was completely off. He used to ride the riding lawnmower and cut his parents' grass. He was walking on a walker when he came to us, but he had to have 2 people beside of him. He eventually was able to walk all around his yard with his walker, ride the riding lawnmower again without having fear of falling off of it. And he was so motivated. He made me put that Lokomat on for an hour. He made me increase the force. He made me increase the speed. He was sweating, and he was drinking pop, and he loved it. He loved it, and you could just tell that he drove all that way 2 and 3 times a week just because he knew he was getting better with the Lokomat system. We've also had spinal cord injuries, like Shalonda said. I had one recently. A brand new spinal cord injury from a car accident. Never thought we would ever get him to walk again. Fortunately for him, it wasn't a complete spinal cord injury. He was able to get return back in his legs, and the Lokomat got him to the point where he was able to go home walking with a walker for short distances at home. He would never have been able to do that had we not had the Lokomat system. And now that we're receiving a lot of spinal cord injuries in the area, we have excellent physicians here in Pikeville that we would love to see more spinal cord injuries in this Lokomat system, more stroke patients, anybody with any kind of neurological disorder that causes you not to walk normal, quote normal. We would love to assess you and see if this system is right for you to improve with your walking pattern. Our wish is that you will never have to use this machine. But if you do, if you ever do nobody wants to be a stroke victim. We all want to be healthy. But there are stroke survivors out there. There are car accidents that happen every day. And if you come across somebody in your family or you that unfortunately comes across that disease or illness or trauma, we are so glad to be fortunate here in Eastern Kentucky to be able to provide you with this Lokomat system, because it is high technology, the latest in science, to help you to regain your independence and be able to get back to doing what you were doing before you had your injury.
Now, let's learn how the Lokomat technology came to Pikeville Medical Center and how our patients and doctors feel about this exciting technology.
Hello, I'm Debbie Puckett, Vice President of Rehabilitation Services at Pikeville Medical Center. I'm a physical therapist by background, and I've been here about 38 years at the medical center, and I started the physical therapy department in 1973. And it's been exciting and rewarding to work at Pikeville Medical Center and see rehabilitation services be provided to this community and grow. It's just so rewarding to see the difference rehabilitation services have made in the life of patients. So one more big change and improvement that we saw the chance to make was the Lokomat. I was at Chicago Rehab, which is the #1 rehab hospital in the country, and talking to their COO and touring the facility, and I saw the Lokomat there. I was so impressed and knew that it would be something that would benefit the patients in Eastern Kentucky and the region. However, Chicago Rehab said, oh, a hospital that small or in Eastern Kentucky, I'm not sure that you all could offer this expensive, high-level technology. And I was like, well, you don't know Mr. May and the board of directors at Pikeville Medical Center. We have the best technology in many departments that large urban hospitals would love to have. So I said, if anybody can have a Lokomat in their rehab hospital, it will be Pikeville Medical Center. But I researched it for a couple of years. I wanted to make sure that we would utilize it, and then we had to get the training, and it came true. And it is so exciting to have this when there's only like 70 in the whole country. And as far as the pediatric attachment, people can use it on adults, but there's only 16 to 20 locations, I believe, in the whole country that have the pediatric attachment. So what I could see was all the people in the region that needed intensive ambulation training to help them walk again. You need repetition for like a half an hour, and because that's usually labor intensive, you can only do it for 5 minutes as a therapist. But with this robotic machine, I knew the spinal cord patients, the little cerebral palsy children that it sometimes takes 10 hands to help them walk correctly, that they could be molded in the right position and get to walk 30 minutes. And to see a patient's face when the first time they walk correctly and can do that for 30 minutes, it gives you chill bumps. So I'm so excited to have the Lokomat. And the exciting thing for me too is we can offer it to our inpatient rehabilitation hospital, where we have the only one in the region. I mean, there's no other place you can get this service, even in West Virginia that borders on us, Tennessee, people come, this region, and we're the only inpatient physical rehabilitation hospital. So now people can get that while they're in the hospital their first 2 weeks, but also outpatients can get it. So that way the outpatients, the little children that we see in our rehabilitation building in the Riverfield, or stroke patients that need longer care, spinal cord, multiple sclerosis, Guillain-Barré, Parkinson's, just any neurological condition. So I'm just so excited there that our in and outpatients can benefit from this machine.
Hi, my name is Margie Blackburn, and I'm the director for the inpatient rehab unit that's on the 10th floor at Pikeville Medical Center. And I've been a nurse 28 years. And actually the past 10 years has been, my focus in my career has been on the physical rehab part. And I will tell you that it has been the most rewarding 10 years of my entire career, especially the 6 years I've been here at Pikeville Medical Center. We have added so much technology and new equipment for patients to use that it has been so inspiring to see patients improve and go home and improve their quality of life and actually improve their functional ability. I know that the first time that we brought the Lokomat on the unit, that I came in and looked at it and I felt, my goodness, this is so intimidating for just the average patient. But actually once you get in it, in the room, and you see the equipment, and they fit you in the harness, and you feel, especially those spinal cord patients or the strokes, that actually haven't had this advantage to use this type of equipment, and the first time that they feel, being able to put their feet on this treadmill, you see tears in their eyes, and it's just such an emotional feeling. I noticed that the staff even will come in and watch them, to see them, because it's an emotional time for all of us. It thrills each and every one of us to see patients improve and go home, especially with their families. One thing I want to mention too, that because this equipment is so large, quite frankly, it could be rather intimidating the first time that you see it. But I want to reassure everyone that our staff is so highly trained and skilled in this, that there's just so many safety precautions on this piece of equipment that it can be stopped in just a second's notice. You know, if anything would arise that they felt like that they would, you know, want to stop it, that it can be stopped. And there's so many, I guess, checklists that they go by in order to maintain the safety during the time that you're getting this therapy. The one thing, too, that I've noticed is that the patients can progress also with the harness because, and by that I mean that the harness itself, they can gradually be lowered each session that they have so that they're actually holding up more of their body weight when they're walking on this treadmill so that, you know, they really don't, probably themselves don't realize how much they are progressing. So until later, and then they feel the strength start to come back in their legs, and it's pretty amazing. So it's a wonderful piece of equipment, and we are very fortunate here in Eastern Kentucky to have this. Actually, I'm from Williamson, West Virginia, and over in the West Virginia side, you know, we have nothing so whatsoever to equal this. And I know that I have talked to different stroke patients and spinal cord injury patients and encouraged them to come over to use this equipment. Otherwise, they would have to drive so much distance to even, you know, hope to get to a chance to use this equipment and gain back some of their function. So I do want to encourage everyone, if they are just curious about it, or if they have a family member or someone that they feel would benefit from this, to give us a call. The number again is 606-218-1053, and we'll be happy to discuss it with you and, you know, even talk to their physician, you know, if we would want to find out if they feel like that they might be a candidate for it. So, you know, just anytime, just give us a call. We'd be happy to discuss it, simply because we would like to see everyone gain function back in their lives. And actually at Pikeville Medical Center, you know, we want them to recover close to home. That is our dream here, you know, to have everyone have access to health care and the topmost in technology. So anytime, again, my name is Margie Blackburn, and you can call the unit and ask for me. And if you would need outpatient or whomever to talk to or whatever, we'll be happy to put you in contact with them.
Hello, my name is Dr. Tracy Kent. I am board certified in physical medicine and rehabilitation with a subspecialty in spinal cord injury after completing a fellowship in Richmond, Virginia. I'm now here at Pikeville Medical Center working in the rehabilitation department, and wanted to talk to you a little bit about the Lokomat, which is a great piece of equipment and a great tool that the physical therapist can use specifically to work on patients with spinal cord injury who are no longer able to walk like they once were able to do. But not only spinal cord patients can benefit from this, but brain injured patients can, patients with cerebral palsy, or even strokes. Pretty much any condition that causes a physical disability that limits their ability to walk without assistance could potentially benefit from this great piece of equipment. And one thing I've noticed is that Pikeville Medical Center is one of the few places that actually has this Lokomat machine. I've trained at several hospitals and been to several different rehab units throughout the country, and it's actually quite rare, so we're very, very fortunate to have this, and I think it's a great benefit to all of our patients. So some of the benefits to the Lokomat therapy, specifically for patients with neurological conditions like spinal cord injury, stroke, or brain injury, are that it can not only improve neurological recovery, meaning that it can retrain the brain to send messages through the spinal cord and out through the nerves and into the muscle to work like they once did, but it also has several other medical benefits. One of those things would be that it prevents osteoporosis because you're walking and you're weight bearing on your bones, so you're helping to keep them strong and prevent breaks down the road. It also helps with spasticity, which is a condition that often happens after a brain injury or stroke that causes your muscles to tighten down and limits your range of motion. So, you know, improving range of motion and reducing spasticity are some of the great benefits that the Lokomat can provide.
Thank you for your interest in the Lokomat at Pikeville Medical Center. If you have questions, feel free to contact the hospital at 606-218-3500.